Hi, so I have just arrived at the hospital and I thought I would do a quick pregnancy update. I'm now 31 weeks and never expected to be at the hospital because, as you know, I was aiming to have an unassisted pregnancy and unassisted birth, but things have changed a little bit, not too much, but a little bit. So what happened was, last week I was feeling absolutely exhausted, like horrendously exhausted, and I thought I need to be tested for anemia because although I'm taking my iron supplements, I don't think I should be feeling this tired. So I made an appointment to see the midwife, and just purely so that I could have my blood tested for anemia. And also I needed a MAP-B1 form, which is the form that you need that I need for my husband, so that he can take 2 weeks paternity leave and still be paid, because I really need him to be able to help me after the birth, because obviously I've got lots of children that need looking after. So I made the appointment and I was absolutely dreading it because I thought, it's just not going to go well, because they're not going to be happy about me having all this unassisted pregnancy and wanting an unassisted birth and all of that, and also just because of the COVID situation and there being lots of strange rules going on at the moment. They want you to wear masks in the doctor's surgery and in hospitals and things like that, and I will not wear a mask. I cannot wear one. The thought of it just makes me panic. Even if I'm around people that are wearing masks, I feel very panicky. So that was very difficult for me. So I went to the doctor's surgery, drove there, and I literally was having a panic attack in the car, thinking that they're probably going to make a big deal about the fact that I'm not going to wear a mask. But I managed to go in anyway, and it was actually fine. They didn't say a word about me not wearing a mask, didn't mention it at all, so that was lovely. And then I saw the midwife, and I sat down in the chair and I just had complete verbal diarrhea, telling her why I have had an unassisted pregnancy so far and how I am really sick to death of this whole COVID thing, and that I cannot stand the mask situation, and that's why I'm not going to be going to hospital and I'm going to have an unassisted birth and blah blah blah. And she said to me, can I stop you there? You don't have to explain yourself. And I said no and just carried on with my verbal diarrhea. And then after I'd finished, I said, there, now we both know where we stand. I just needed to sort of explain how I felt about everything. And luckily she was kind of on the same page as me and just thinks that, yeah, all these rules and everything are ridiculous. And she said to me, but you're wrong. I was like, what do you mean? And she said, well, we will support you, because I said to her, I know that you're not going to support me because, last time I had a baby, that was 4 years ago, and you told me I was too old to have a home birth then and that I'd had too many babies then. So obviously I'm not going to get any support with this time having a home birth. And she said, no, you're wrong, because actually if you just refuse to go to hospital, which you are, we can advise you that we think you should, but we have a duty of care to send midwives out to you. And she said they will be shitting themselves because of the supposed high risk that I am of heavy bleeding and all of this because of all the pregnancies that I've had, etc, etc, but they have to be there. So I was like, really? I never knew that. This isn't what I was told last time, but brilliant. Okay, so it's really nice to know that I do have that support. And then she wanted me to do the usual thing of like going to the hospital to see the consultant, And I said, no, I can't go to the hospital. I can't be dealing with all that face mask stuff. I don't like it. And she said, oh, well, it's over the phone now anyway. And she said, all you have to do is sort of listen to the consultant and go, yeah, and then still do your own thing anyway. But it just, it covers there. So I said, okay, yeah, I can do that. And then she said, and also, would you go for a scan? And I said, well, I really don't want to go to hospital, so no. And she said, but it would be really handy to know where the placenta is. And I said, well, that has been actually a worry of mine in the back of my mind, because if the placenta is in the way of the baby coming out, then obviously that's going to be a massive emergency, and there's nothing anyone can do about it other than cesarean. But if you know about that in advance, obviously that prevents there being an emergency situation at the end. So I said, I do want to know where the placenta is, but I don't know, I can't handle this mask situation, all these muppets and masks around me. It just does my head in. And she said, oh, that's fine, we can arrange for you to have an appointment first thing in the morning, and get the first appointment when no one else is around, and you don't have to wear a mask, you've got your exemption card. Yeah, you've got your exemption card, so there's nothing they can say. And I was like, really? And she said, yeah, that's absolutely fine, you can take your husband along. I was like, really? And she was like, yeah. So I thought, oh, okay. So that is why I'm here. But actually, this is not an appointment first thing in the morning. This is one of the last appointments of the day. They wanted me to come in urgently because the baby's heart rate is higher than it perhaps should be, borderline tachycardia. But that could be for so many different reasons. It could be a sign of Down syndrome, and I am at high risk of having a Down syndrome baby because of my age. So I'm probably going to be finding that out today. It won't be 100% that they'll be able to see it if it is, or whatever, but they might be able to tell me. Or it could be any other number of reasons, so many different reasons why the baby's heart rate might be that high. But yeah, I'm just going in today just to be checked urgently, just to see that everything's okay. I don't feel particularly worried about it. I don't think it's going to be anything horrifically wrong with the baby. I mean, it might be, but I don't think so. It may have Down syndrome. I really hope it doesn't. Not because, some people think that, it's something to be ashamed of and embarrassed about and all of that. I'm not at all feeling like that. I would just be worried about a child of mine having lots of health conditions and having to suffer a lot. But there are many Down syndrome children that don't have any of those health issues. They just have a few things and it's fine and they're happy. But yeah, so that is what I'm going to be finding out today. Where the placenta is, and whether or not it's got Down syndrome, and I might find out the gender, we'll see. But I should probably get going now and get in there, otherwise I'm going to be late, and I've got someone parked next to me and it's really embarrassing sitting here vlogging while there's someone there. So I shall catch up with you when I get out of there. Okay, so I've just got out of there. I was in there for an hour and a half. I was only expecting to be about 15 minutes, but there were complications, and I just need some time to process that, and then I will continue with this video probably tomorrow. And also I've just paid for my car park ticket, so I've got to get out of here anyway. But yeah, lots to think about. Speak to you soon. Hi, so it's the next day now, and I have had a little bit of time to process the information that I was told yesterday, and to also do a little bit of research, because they didn't go into much detail at the hospital. So basically what happened was they found that there was something wrong with the baby's kidneys, and yeah, I am going to be I am being referred to a specialist at another hospital a bit further away, so I'm going to have to go there in a couple of days, and then I will find out more information about the severity of it all. The condition that the baby has is called hydronephrosis. I don't know if that is how you say it, but that is how it looks to me, and it is just that the kidneys are bigger than they should be. One of them is quite a lot bigger than it should be, and the other one is just a little bit bigger than it should be. So yes, I need to see the specialist. The good thing is that the circulatory system around the kidneys and bladder is working. There's no actual blockage, because what can happen, one of the reasons that the kidneys could be bigger is because there's a blockage and the baby's wee is not coming out, and then the kidneys just swell up and the baby swells up and the actual fluid around the baby decreases. But that's not happening. I've still got the right amount of fluid around the baby, so that is hopeful. But there might be a partial blockage. What we need to find out is, you know, is this a condition that the baby's had for a while and there's not much change, or is this a condition that's just recently started in the baby and it's going to suddenly start getting a lot worse? So I will be scanned again in a couple of days, and then again in 2 weeks, and they will check to see whether the kidneys are, you know, getting more swollen or not. So I mean, I don't know too much about this. This is just from the research that I've done, but I'm guessing that the worst case scenario is that if, you know, there's a blockage and it's getting worse, a slight blockage, not a total blockage, we know there's not a total blockage, but a slight blockage, and it's getting worse, then they might have to deliver the baby early and operate on the baby's kidneys or something like that. But that's like the worst situation. But this is apparently quite a common thing to occur in babies. It happens in 1 in 100 babies, and most of the time the situation resolves itself, often before the baby's even born, or sometimes up to a few months after the baby's born. In other situations it can lead to the baby having lots of urinary tract infections, and they will have to have antibiotics and things like that. So yeah, there's lots of different outcome possibilities with that. I have no idea how bad this will be, but like I say, at least it's not a total, there's not a total blockage there, and the baby is being able to release some urine. So that's is hopeful in a way. But yeah, it was very, very shocking, and when I came home I just burst into tears when I told my husband about it, because I didn't know anything at that point. I hadn't looked it up online, or, you know, but now I feel a little bit more optimistic about it. I think it will be fine. Excuse the sound of my children. So this condition has nothing to do with my age, and it has nothing to do with the fact that I've had an unassisted pregnancy up until this point. That wouldn't have made any difference whatsoever. It just is what it is. Yeah, so that was pretty upsetting, but obviously not the worst news in the world. I know there are people that have to deal with far worse things than that. I'm well aware of that, so I'm not gonna be too, you know, down about it. I'm just going to wait and see what the specialist says in a couple of days and deal with it from there. But as for the rest of the scan, everything else looked great. The brain, the heart, the baby's growth, I mean everything. There was no sign of Down syndrome, there was no sign of cleft palate, clubfoot, spina bifida, all those things. So, you know, it could have been a lot worse. Possibly. I mean, I don't know. We'll see how this pans out. There's just a lot of unknowns at the moment. But also the baby is measuring 2 weeks bigger than it is. So they've put my... I knew this would happen. They've put my due date down as 2 weeks earlier than it should be. And I know for 100% sure that my dates are right. And I know that I have big babies and it's not due when they say it is, but they've put that down anyway. So they will really be hassling to induce me because my babies are always late anyway. So I'll have to deal with that. But, you know, one thing at a time. At the moment, you know, I'm just glad that there was no real concern about the heart rate this time and nothing wrong with the heart, which is why I was originally sent there. And yeah, that is my update. So, and in a few days I shall tell you what happens when I go and see the specialist. So yeah, anyway, a strange pregnancy update. Never expected it to be like this, but yeah, I'm really glad that I did go and see the midwife actually, because like I said, I had no idea that they would support me with a home birth. You know, if everything goes okay with this kidney situation, then I can quite happily have a home birth, and if I want midwives to be there, they can be there, or if I want to carry on having an unassisted birth, I can do that, but then call them out afterwards to check everything, or, you know. So it's just lovely to have those options open, and feel like I'm receiving some support and some care, because up until now I have not felt very cared for in that way, you know. So yeah, anyway, I'll leave the video here for today and I shall speak to you again in a few days. Thanks for watching. Bye.